Thank you, Mr. Speaker. Mr. Speaker and honorable members, on the 30th of January 2020, the World Health Organization declared the novel coronavirus outbreak a public health emergency of international concern, and by the 11th of March 2020, the WHO had confirmed COVID-19 as a global pandemic. At that point, health systems around the world were already beginning to grapple with thousands of severely ill patients and hundreds of extraordinarily sad deaths. To this day, many health systems continue to experience enormous pressure brought on by successive waves of the coronavirus variants such as Alpha, Beta, Delta, and Omicron. Mr. Speaker, here in Bermuda, the government took immediate steps to ensure our health system, including the island's only acute care hospital, would be capable of coping with the anticipated high levels of sick individuals and hospital admissions. Our safety measures included stay-at-home orders, remote learning, and remote working, curfews, and restrictions on group activities. The Ministry of Health's Pandemic Response Unit, the Bermuda Hospital Boards, and the island's medical profession and medical laboratories responded admirably without hesitation to support and care for more than 14,000 positive cases recorded since the beginning of the pandemic. Mr. Speaker, although we continue to contend with variants of concern, the world is in a different place than it was in early 2020. Certainly Bermuda is. As of the 14th of May 2022, 74.4% of our population is fully vaccinated, and we are learning to live safely with COVID-19. As part of living safely with COVID involves adjusting to a new normal, including reaffirming our commitment to living a healthier life, something data suggests we have put on the back burner. Mr. Speaker, health professionals in general have noticed a reduction in the number of people seeking health care during the pandemic. A 2021 study conducted by the Urban Institute in the United States found that more than 1 in 10 adults elected to delay or not seek at least one type of care. A similar percentage of parents delayed or declined to pursue care for their children as well. The Health Foundation, based in the UK, found that 6 million so-called missing patients did not seek treatment in 2020. In Bermuda, Mr. Speaker, a decline in annual health examinations and preventative care, which reduced the risk of disease, was also evident during this current pandemic. Compared with pre-COVID fiscal year 2018-2019, Bermuda has experienced a drop in annual checkups with new patients. In the 18 to 39-year-old demographic, new patient preventative care checkups plunged on average of 24% between 2019 and 20 and 2021 and 22. For those between the ages of 40 to 64 years old, there was a 14% decline on average in new patient checkups, while 65-year-olds have remained diligent. Mr. Speaker, a slide in diligence is apparent with mammograms as well, where there was an average decrease of 7% in screenings over the same period. And this is disturbing in view of the fact that for the first time in 2020, the WHO identified breast cancer as the most common form of cancer worldwide. These are just two examples in Bermuda. According to the Urban Institute study, the common cause for the reluctance to seek health care is due to concerns about patients' exposure to the coronavirus, and this is understandable. However, Mr. Speaker, we must reverse the delays in seeking care that may have become normalized over the past 2 years. Young adults need to introduce themselves to annual checkups for their health and make them a habit. Children need to be up to date with their schedule of vaccinations to prevent and reduce the spread of disease. All of us benefit from preventive screening that can detect disease early when treatment can be more effective. Additionally, the Ministry of Health strongly urges those in the community with known risk factors such as obesity, heart disease, hypertension, and relevant family history to reach out to their GP or to the Hamilton Health Clinic for an appointment. Yes, Mr. Speaker, the coronavirus is still here in our community, so the concerns are real, but face masks are required in all healthcare facilities. Also, these facilities have established very stringent cleaning processes and work hard to avoid overcrowding waiting rooms. Preventative care is essential, and it is critical that we resume good health routines. Mr. Speaker, it would be extremely remiss not to recognize the impact COVID-19 has had, arguably, and a more significant impact it has had on our mental health. In a scientific brief issued in March of this year, the WHO indicated a global increase in anxiety and depression of 25%. The main driver for this has been unprecedented stress, which has never been experienced before to this degree and for this duration, along with social isolation due to the pandemic. The Mid-Atlantic Wellness Institute indicates the now prolonged nature of the pandemic has led to many challenges for the Bermuda community. In addition to the fear of being exposed to COVID-19 or the ramifications of infection, MWI has also seen some older adults experience loneliness at having reduced family contact and missing out on events and celebrations. For the frontline workers, burnout and exhaustion have become a genuine concern. Mr. Speaker, in Bermuda, many client presentations to community mental health services have been related to COVID, with anxiety or depression due to job loss or economic instability as a factor. The threat of the impact of COVID, whether health-related, economic, or simply exhaustion due to the length of the pandemic, is woven into many mental health reviews. Persons known to the mental health services required ongoing support, while some have undergone a deterioration in their pre-existing mental health issues. Mr. Speaker, members of the extended Bermuda community have lost people close to them, and having lost close loved ones and relatives, the inability to travel for funerals and memorial services was a further stressor. MWI has seen a number of inpatient admissions related to COVID-19, some with psychotic symptoms following the concentration of COVID-19, having never been involved with mental health services before, and others developing obsessional thoughts due to fear of COVID exposure. There have also been more serious cases of depression, in part due to the changes in work circumstances, loss of loved ones, or inability to pay bills. Mr. Speaker, families had to pivot, balancing work with childcare and teaching during remote learning, and for essential workers, this was particularly challenging. In particular, children have had a difficult journey, having spent significant amounts of time at home, which has doubled as a school space, with extracurricular activities and typical social interactions paused, resulting in less social contact. Social anxiety has been observed in the adolescent group, and there have been some reports of school refusals with the return to in-person classes following protracted periods of remote learning. Further, Mr. Speaker, MWI has seen high levels of inpatient admissions to the child and adolescent services with this ongoing pandemic. In 2019, there were 25 admissions to CAF. Already in 2022, there have been 39 admissions to date, perhaps reflecting a worrying trend. Mr. Speaker, discharges from inpatient care are difficult to achieve and can be drawn out, and it is acknowledged that there remains a need for a diversity of housing options within our community, and we welcome the efforts being made in this regard. The delivery of care for those with mental health disorders requires agility on the part of MWI due to the inability to safely complete face-to-face interviews as a result of the pandemic disaster alert levels within the Bermuda Hospitals Board. Not all patients requiring support had access to digital means to allow for virtual reviews. Nevertheless, MWI continued to be responsive to high acuity situations and be flexible depending on their need, and for that, the MWI team must be commended. Mr. Speaker, more recently, MWI has shifted back to more typical face-to-face reviews with the development of BHB's integration initiatives, which include satellite clinics being held at the Lamfogle Urgent Care Center as part of the Integrated Healthcare Clinic, as well as the Hamilton Health Clinic on Victoria Street. And these are examples of providing care closer to home and continuing work to lessen the stigma associated with mental health and enhance access to care. Mr. Speaker, BHB has supported the development of the MWI Directorate Plan, which reflects a commitment to mental health. Globally, there is a shared concern about mental health among mental health professionals that the tidal wave for mental health may be coming with unknown endpoints due to the pandemic. There's a continued need to be flexible and incorporate care tailored to specific needs, as each individual's journey over this extraordinary time is difficult. So how do we manage mental health during this ongoing pandemic? There's a directory of service providers available to assist, Mr. Speaker, at helpingservices.bm/directory, which can be used for general health and also filtered for health mental. As WHO has stated, no health without mental health. Therefore, it is vitally important that we value ourselves and prioritize self-care. Mr. Speaker, with that in mind, MWI offers these tips for all of us to follow now. First of all, be gentle with yourself. We have been living through unprecedented times, and there is no right way to respond to the stresses we have been facing. Experiencing a degree of anxiety is normal. Take a break from the news. We can sometimes feel bombarded by negative news and images, so disconnecting and doing something else can be a good distraction. Reconnect with previous interests to instill a degree of normalcy. Take care of yourself. Try to eat a balanced, healthy diet, exercise, lessen your alcohol intake, and avoid alcohol and other substances as a go-to if you're feeling stressed. Prioritize sleep. Try to maintain connections with others, including family and friends. Focus on what you can control instead of worrying excessively over things you cannot control, and avoid spending too much time on social media. Practicing mindfulness can be beneficial, and this can be a simple addition to your day. Practice gratitude. Pause and reflect on what we remain grateful for, along with reminding ourselves what might be going well despite the pandemic. And take things at your own pace. What works for some may not work for others. And finally, Mr. Speaker, take a look around. We are living on an island of exceptional beauty. Absorbing the vibrant colors of the ocean and getting out into nature can be very restorative for our mental health. Reflecting on the journey that we have been on, let us be kinder to ourselves and to one another, because it can positively impact our own mental health. Thank you, Mr. Speaker.